The statistics show that the oncology department at the St. John's Hospital is probably the most active and, in one way, critical service that the hospital has to offer.
When I had found out that I was going to have chemo, I was really worried about how I would be able to do it.
There are definitely patients out there that are not getting the care that they need because of travel, because of the expense of it, or just knowing that they have to go to a big center to have things like that done, or thinking that that's the case.
Having the oncology department here in Jackson that's only 60 miles away, and the quality of care that we get here, it takes that stress out of travel and motel time and those type of things. And I just think that we are very blessed.
Some people initially think of St. John's Hospital as a small place, and how could anything as complicated as cancer treatment be done here? And they may start out at a big fancy place and then quickly find that maybe a lot of it can be done very effectively here.
In 1998, we started off with 3 patients, 3 oncology patients, and now today we had 400 visits, over 400 visits a month of oncology patients, so it's really grown.
That space is too limited for the community growing the way it is. I have been receiving the best possible care here that I could imagine. From diagnosis to treatment was right around 1 month, which was pretty incredible. My feeling is if I was in a big city, it would have taken anywhere 3 to 4 months to get the same thing done.
The people there that take care of you, the RNs, are all just wonderful and very caring with you each time you come.
We are so fortunate to have Dr. Ward come to our department. I've worked with many oncologists in different hospital settings, and I've never worked with a doctor that is so competent and approachable and with such a kind demeanor for our patients.
We're at the edge, at the cusp of a real population and industrial growth in these 2 counties. And it's really, really important that we be able to deal with the chronic disease with acute elements that's typical of cancer patients. And the thing that's a challenge is with cancer, you can't just give a shot or just take out an organ. You have to deal with the whole patient.
A couple of the things that have been given to our department, which has really made life so much better for the patients, is we have an ultrasound machine now for putting in PICC lines.
Our PICC line insertion rates have increased tenfold. The patients are happier with the location. We can choose the veins we want to use. We're eliminating need for extra x-rays to check placement because we already know that they're in place because of the device that we now have. It's just been awesome to have here.
The other thing that's really made a huge difference in our department is an automatic door opener.
We actually had a couple patients fall trying to get into our door without the device that we now have. So it's been a great help to this department and to radiology staff and for those trying to get equipment in and out of the room. It's just really couldn't have come at a better time.
Since we started coming up, the growth has been dramatic. When I first came up, we had just a couple of chairs and we were crammed in one little space, and now for several years the space has been increased and it seems to be full a lot of the time.
As our patient population has grown, we have less and less space in here. We're needing more equipment, we're needing more IV poles and blood pressure monitors, which just takes up really every last inch of space that we have. And on top of that, you know, it's rare not to have a patient in here with a family member or multiple family members. When that happens, it becomes sometimes near impossible to get close to a patient, to talk with them about how they're doing, to get in to draw labs, to do vital signs.
It just seems like the space for as big and for as many people that are treated here, you know, it would just be good if you had more space.
We definitely need more nursing space. There's not much place where you can be really confidential.
When we first see patients, we do a lot of teaching and we do a lot of interviewing, and you know, some things are very private, and to not be able to have the space or a room to go to do that is really sad that we can't provide that right now.
You're going to need to have good doctors and good nurses and good technicians, but you're going to have a facility that encourages them and helps them give the type of compassionate service that is really necessary. I think the time for action is way overdue.